Welcome to part 4 of clinical evaluation of the peripheral arterial tree. I'm Dr. Ali Sabbour, Professor of Vascular Surgery in Shams Medical School, Cairo, Egypt. Part 4 will demonstrate palpation and auscultation of the peripheral arterial tree. In palpation, first we examine the skin temperature. In skin temperature examination, we are looking for a level of temperature drop. In a normal limb, the temperature will drop gradually as we go down towards the foot. If a major artery is occluded, you can detect a level of temperature drop compared to the normal side, where the temperature drop is smooth and gradual. Skin temperature can only be assessed reliably if both lower limbs have been exposed for a full 5 minutes. The cool, dry back of the fingers are ideal temperature sensors. You should practice this skill in your clinical round session. Next, we examine the capillary refilling. Press on the tip of the nail or the pulp of the toes or fingers for about 2 seconds. A blanched area will appear. Then, remove the pressure and observe the time taken for the blanched area to return pink. Ischemic limbs have prolonged or delayed capillary refilling time. Sometimes we call it a sluggish capillary circulation. This sign is very evident in acute ischemia. The next step in palpation is palpation of the peripheral pulsations. This is very important, and every student should be confident that he or she is able to palpate for the peripheral pulses properly. As a prerequisite knowledge, you should recall your first year anatomy course and name the arteries of the lower limb starting from the aorta. Please pause the video, look for the names of the arteries, and when you are confident enough, run the video again. Peripheral pulse examination. As a general rule, pulses are easily felt where an artery is superficial and as it crosses a bone. Refer to your clinical textbook for detailed instructions of how to feel different pulses. This skill will be demonstrated in details and practiced within your ward session. The common femoral pulse is felt below the midpoint of inguinal ligament against the head of femur. The red line marks the anatomical site where you should look for a palpable common femoral pulse. You will be coached during the ward session to palpate the common femoral pulse. As an advice, you should first practice on a normal individual. Next is the popliteal pulse, which is palpated in the popliteal fossa. The popliteal artery is deep and can be palpated at different levels. Here, here, or here. You will be coached to practice the different techniques of palpating the popliteal artery during your ward session. This is an example of how we palpate the popliteal artery at the lower part of the popliteal fossa with the fingertips of both hands against the tibia. You will be coached to practice the different techniques of popliteal artery palpation during the ward session. We palpate the posterior tibial artery behind the medial malleolus. Finally, we palpate the dorsalis pedis artery on the foot dorsum just lateral to the tendon of the flexor hallucis longus. In case you do not feel the pulse, the pocket Doppler is used to detect blood flow within the arteries. Use of the pocket Doppler will be demonstrated during the clinical ward session. Auscultation is the final step. Normally, the laminar blood flow through normal arteries is silent. However, with arterial stenosis, the turbulent blood flow can produce a noise that is best heard by the diaphragm of the stethoscope. This is called a systolic arterial breathe. Listen along the course of the main arteries. The sites for auscultation for arterial breathe are demonstrated on the figure. History taking and examination are tools used to collect clinical data about your patient. By the end of history taking and examination, you are expected to integrate the data collected and formulate a working diagnosis that includes anatomical, clinical or pathological, and an etiological diagnosis. Be sure to practice this intellectual skill during your clinical ward session. Thank you.